My name is Majd Makul. I'm an assistant professor of pediatrics. I'm a pediatric cardiologist by training. So I basically take care of kids and adults who are born with heart defects. So for me, pediatrics has always been, my passion, and I wanted to do something that actually will make a difference in, kids and families' life. And I always was fascinated about the heart, even growing up. So this combination of the kids and the heart has always been kind of on my mind, if you will. So it was the perfect fit, from my ambitions and fascinations growing up. We mainly take care of pediatric patients that are born with heart defects or acquired some kind of heart problem, along their young life, if you will. But because of the advancement that the field has achieved in the last, I would say, couple decades or so, we actually currently in the United States and the Western world, we have more adults with congenital heart defects than we actually have kids with congenital heart defects. So those were basically kids born with minor or serious heart defects that was palliated, surgically or medically, and they require usually lifelong follow-up for the majority of these defects. So when they turn and become adults, we continue following them, and sometimes we use, of course, extra help from our adult colleagues who are trained in congenital heart defects too. You're not just dealing with a patient, you're actually treating the whole family. And that's a privilege, and I try to keep reminding myself of that, because you have to manage expectations for the family, and you have to manage, if problems happen, and they do happen, for these patients, unfortunately. Sometimes we have bad news we have to deliver, and sometimes they're young to understand, so you have to simplify it for the kids, and at the same time, explain it to the parents in a way they can actually make informed decisions about. If I'm taking care of somebody's, kid or brother or even parent at some point, it's more like, I'm taking care of my own kid or my own parent. So I try to give them the best care that I'm capable of. UK is a pretty big healthcare system, and for us in the pediatric world, we have a sub-specialized team, if you will, that covers all the aspects of pediatric cardiology, starting again, as I told you, from the fetus and imaging their hearts, and going all the way up to the surgical interventions and the non-surgical interventions that are needed in these patients. On the other hand, what also sets us apart, if you will, is the actual regional collaboration that we have with other programs around us, including Cincinnati Children's Hospital. So for us, from a cardiology standpoint, for kids, Cincinnati Children's and Kentucky Children's is actually one big team right now. So we have, extended expertise that we can use and at our fingertips, basically, to serve our patients and give them the best care they need closer to home.